Situation right now here is really very worst, critical, and out of control.
A similar message echoed across India today, recording the most ever new COVID cases for any country, more than 330,000. That is a frightening number, and the reality is likely a lot worse. Hospitals are full and running out of oxygen for the sick. It's a dire situation that has mobilized some Canadians with ties to India, including a group of doctors now fighting the pandemic from abroad. And one of those people is Dr. Madhukar Pai, a physician and professor of epidemiology and global health at McGill University, and he joins us from Montreal this evening. Dr. Pai, I know this is a grueling time for you. What are you hearing from relatives and friends who are in India?
I think Indians everywhere, Ian, are in a state of shell shock. I mean, we just can't even believe what has happened in a relatively short period of time. Everybody, including us that we know of, has somebody or the other, friend, family, colleague, work acquaintance in India who's currently dealing with COVID. I mean, it's not even possible to describe the level of devastating nature of this second wave. My own immediate family in India is impacted. Entire family is down with symptoms. I have childhood friends who are frantically WhatsApping me, asking me for advice because none of them can get medical care or hospital care right now. So we are pretty much managing our own close family members and friends as best as we can. And we put together simple tip sheets to help many such Indians manage this disease on their own because there is no hope of them getting much medical help at this point.
Can you imagine that it's come to this, that you and others have had to send out these WhatsApp messages and tweets with kind of basic information on how to care for yourself at home if you have COVID? Did you ever think it would come to this?
I mean, Indians were all kind of congratulating themselves and celebrating when the cases started dipping down towards the early part of the new year. And then I think the country pretty much gave up on public health, right? Simple public health measures like masking, physical distancing, everything went out of the window. There were huge congregations, religious congregations with 3.5 million people, live cricket games with hundreds and thousands of people, election rallies across the country. And then before you knew it, this what I think is a bunch of new variants, the curve is started going up like a rocket. And now it's like a vertical wall, it's like a tsunami wall. And the numbers are beyond any imagination. The official figure, as you know, is about 330,000 per day. But that would be underestimated by a factor of at least 10. So that puts it at 3 million plus cases per day, and at least 2,000 deaths would be 20,000 deaths at least per day, and that is just and the epidemic is doubling at a very fast pace. So we are looking at a disaster of unimaginable proportions.
Just time for one last question, and you know about the travel ban of prohibiting direct flights from India and Pakistan to Canada. How do you feel about that?
I can understand when there is a massive problem, travel restrictions need to be in place, and we've done that with other countries as well. But what I think many Indians fear is a potential racial backlash, just as we saw with the anti-Asian racism around the Chinese virus or Wuhan virus type of a thing. When you say Indian variant, already there are news reports within Canada with such racist headlines. And we really hope that Canada won't go that path. And who knows, we may have a variant in Ontario if you don't control the epidemic within Canada. So it doesn't matter where the variants come from or what they're called. What matters is we need to control the pandemic in all parts of the world. The only way we're going to end this pandemic is not by just vaccinating ourselves or our countries or closing our borders, but to end the pandemic in every part of the world for all people, so that we can come out of this as humanity, not as Canadians or Ontarians, because virus does not respect any boundaries.
Dr. Pai, thank you very much for taking some time with us tonight.
Thank you, Ian.